Zipline Ghana has announced it will build 3 additional drone centers in the country by the end of the year. The first of 4 facilities was officially launched this morning by the Vice President in Omenako in the Eastern region. CEO of Zipline International, Kela Ronaldo, says the 3 other facilities will be ready in 9 months. Before we hear from him, though, the Vice President has been talking about it. JoyNews' Matilda Wamega brings us a story also from the Tafo Government Hospital, where impact of the drone service is being felt.
Kofi is the first person at the Tafo Government Hospital to have received emergency blood supply through the drone technology. Doctors operating on him on Monday had to call in for an emergency blood supply from the Zipline Center when they ran out of stock during surgery.
This service has really helped me. I am sure it will save a lot of lives out there.
So on to Woodia and the Ujida baby, I say, who here, but so or two and who say near Omokan and Cray or say Ubua.
If you haven't experienced what I went through yesterday, you would easily criticize government for this intervention. It can do a lot of good to the people out there.
But for the timely intervention of the drone supply, anything could have happened to Charles.
All the force, they done the operation and they come out. But he alone is there. So I was worried. You understand me? Yeah. But we did that short time way, as so say this thing, that blind band, bring the blood before they took it and then go and operate my brother. Before my brother is alive right now. I thank God. But this one, it can help me and you. If it hasn't happy on you, you don't know say it's good. But if it's happy on you, you know say this thing is a very nice thing.
The Tafo Government Hospital took delivery of its first emergency blood on Monday during Charles's surgery. On Tuesday, they took delivery of vaccines for the immunization of children in the area. This is the first of 500 government hospitals within the Omenako-Suhum area in the eastern region to have benefited from the much talked about medical drone service.
It's good because if you go to the villages and we need a vaccine, I think it's faster than motor or car or anything. Yeah.
Medical professionals here tell me they get regular supplies from the regional medical stores in Koforidua, but usually it takes 3 to 4 hours to get supplies when they request. Flying a drone from the Omenako base in Suhum takes 30 minutes round trip. Director of Clinical at the Tafo Government Hospital, Dr. Eric Ansuoben, says the drone intervention will reduce needless deaths recorded due to the shortage of essential blood and medicines.
In our part of Ghana, we regularly get drug stockouts, and also it's difficult getting some blood groups when you need it and how you need it. Yesterday, for instance, I used this service. There was a patient in theater who was hemolyzing. We needed FFPs, fresh frozen plasma. Our labs can't offer it. But when we called the service, they were able to deliver in good time. And that patient is doing well now.
When you say typically, how long would it have taken the hospital to get such supply from the medical store?
It would have taken over a day, because we would have to make the request from Koforidua, send a car. You have to make sure they have it or not. They also do get stockouts. So even the probability that you will get it or not is not guaranteed.
The 4-year contract with Zipline, the company implementing the project, stipulates that the drone medical delivery service will make on-demand emergency deliveries of life-saving medications to over 2,000 health facilities across the country. Justin Hamilton is the head of global communication at Zipline.
We'll be rolling out all 4 bases over the course of the year. Ultimately, we'll be serving over 2,000 clinics and up to 12 million people in Ghana.
Okay. This is the first of 4 drone centers that will be established here in Ghana. at the Omenako Center here in Suhum in the Eastern region. This facility is expected to supply emergency medical supplies to over 500 health facilities within the Eastern region. We are told that in the coming days, 3 facilities will also be put up. One will be in the Eastern region, another in the Ashanti, and then the Northern region. For JoyNews, Matilda Pamaga, Omenako, Suhum, Eastern region.
Matilda Womeka there. We can now hear from the CEO of Zipline International, Killer Ronaldo, who says the 3 other centers will be ready in 9 months.
This partnership will be building 3 more distribution centers over the next 9 months, just like the one that we're at now. We're going to, by the end of this year, be serving almost 2,000 hospitals and health facilities, making this the largest commercial autonomous system of any kind anywhere in the world here in Ghana. And this system will cover 12 million people, and we're hoping to then increase from there. We'll be delivering almost 150 different medical products and doing that using almost 120 different autonomous aircraft, each one designed and manufactured with precision and care so that they can fly in any weather at 100 kilometers an hour directly out to patients who are having medical emergencies. Every day, we'll be making up to 600 autonomous flights delivering medical products. I want to pause for a moment and think about that number, 600. That means that every day, because of this partnership, we have the capacity to save 600 lives every day. And data shows us that the majority of those lives are going to be moms and children. So this means that we're going to be able to ensure that children grow up with their mothers and families can avoid heartbreaking loss. So those are the numbers. But we're proud of a lot more than just the numbers. We're proud of our team on the ground here in Omenako who have worked tirelessly to make it possible to launch Zipline in Ghana. Our fulfillment teams, global operations teams, flight operations teams, and new deployments teams, they blow us away every day with their ingenuity, creativity, relentless drive, and brilliance and kindness.
The Health Minister, Kwekwa Menu, says government is working to reach health facilities in the remotest parts of the country.
This revolutionary healthcare service will help save lives, decrease waste in the system, and increase healthcare access for more than 15 million people across the country, most especially remote areas that are very difficult to reach. As you may be aware, our mission at the Ministry of Health is to contribute to the socio-economic development and the development of a local health industry by promoting health and vitality through access to quality health for all people living in our country. This is not only achieved through the core mandate of managing and growing our network of health facilities, but also through empowering our committed workforce with the tools they need to save every single life. It is for this reason that we are sincerely grateful to you, Your Excellency, for the bold commitment and tireless support you have provided to this ambitious project, because we know that it will help our country's health system leapfrog into a 21st century system that can cater for the needs of all.
Let's now hear from Vice President Dr. Mahmoud Baumia on the drone service.
And we should all make sure we register. The introduction of the national ID system is to give every Ghanaian a unique identity so that from childhood to your retirement, you will be known and you can have access to or benefit from all kinds of services. And with the introduction of the digital address system, we will also know where to find you. We have also used technology to deepen our strategy of inclusiveness in the financial system. So many people were deprived of financial services. But now with your mobile phone, you can transfer and receive money through your mobile money account, through your mobile wallet, and through a bank. There's interoperability now. Ghanaians have joined the financial inclusion revolution. The excitement, however, today, as we are here in Omenako, is for two reasons. First, we are using technology to increase the access of Ghanaians to one of the basic public services that every citizen deserves. Second, we are using technology to solve a major problem in our health delivery service to those in remote areas that cannot be reached easily by roads. If you have to get to the Dwarf Islands on Afram Plains, standing from here today, and someone needs medicine on one of the Dwarf Islands in Afram Plains, just think of how long you will take to get that medicine to that person. We can now prevent the death of the mother in labor in these deprived areas who needs blood. We can now deliver critical medicine like snake serum to regional and district hospitals in the shortest possible time. I am personally excited because today, Ghana joins other countries in using drone technology to deliver healthcare services. And we are also launching the biggest medical drone delivery system globally. That is the biggest in the world.